Hey guys, today's video is on PT management for mastectomy. So first thing which we will include is goals. In goals, we make sure that first goal is to gain the patient's confidence. Second is maintain the ventilation, reduce lymph edema, pain relief, improve range of motion and improve the strength, improve chest expansion, posture correction and advice. So let's see. First is to gain the patient's confidence. Therapist shall provide the psychological support to the patient, increase their self-confidence, encourage the family member to support the patient, and explain the importance of physiotherapy to restore normal function. Patient's confidence is very important because patient might be like depressed, or patient may be having fear of social rejection. So family support is also equally important for this patient. Second thing is to maintain ventilation. To maintain ventilation, we can always teach diaphragmatic breathing exercise. You can describe in detail that how you have to go for diaphragmatic breathing. Then we can go for teeth supported coughing and huffing. So we can start with huffing first, and then we can teach them supported coughing, so that whenever the patient is coughing, the patient do not get pain over the incision site, right? And we can always go with ACBT, that is active cycle of breathing technique. Third thing is to reduce lymphedema. To reduce this lymphedema, we can first thing we can go with manual lymphatic drainage. That means you are draining the lymphatic fluid towards the lymph nodes. So in this we give repeated stroking and circular massage is given from distal to proximal direction, that is from the wrist to you are going towards the axilla, okay? And direction of massage is distal to proximal, and you can go for 10 to 12 minutes. You can give repeated stroking or you can go for circular massage. So there are basically three nodes, because the axillary lymph node might be removed during the surgery. So we can go for opposite axillary lymph nodes, we can go for clavicular nodes, and we can go for inguinal lymph nodes, okay? Then we have compression therapy. Same for lymphedema, we can go for compression therapy, where we go for strap bandages are placed from distal to proximal, and it can be wear throughout the day and night. You can use compression garments which could be wear during days, and there are some pneumatic compression therapy which provides compression, and it will be helpful to drain the fluid. Next thing is elevation of the limb. We can write that we can elevate the affected part towards above the heart level with the help of pillows. 2 or 3 pillows could be placed under the hand, or wedges could be used. Then next thing is active muscle contraction. So you can go with all the active movements of the head, neck, trunk, shoulder, fingers. Exercise could be done twice a day, 10 times each. Okay, it is very good given in Kishner. You can refer this from Kishner. It is nicely given, the exercise for lymphedema especially. We can also mention here a diaphragmatic breathing. Okay, diaphragmatic breathing could be also helpful to the patient. Then the very important thing is Faradism under pressure, in which you have to write the method that patient would be in supine line. We will elevate the limb with the pillows, and then we will place the electrodes over the flexor compartment at the arm, forearm as well as in the hand, and we'll apply the crepe bandage on it from distal to proximal, and then we will set the intensity on the machine. It would be as patient tolerate. High voltage is provided and continuous mode is given for 10 to 20 minutes approx. Now another thing, rather than lymphedema, the patient will be also having pain over the incision site. So for pain we can go with TENS, that is transcutaneous electrical nerve stimulation, where we place electrodes around the incision site, and intensity as patient can tolerate. You have to write like this: time 10 minutes. You can always go for ultrasound to break any adhesions, and you can write this intensity 1 megahertz, continuous mode 5 minutes. Massage techniques, there is especially your kneading technique, and for kneading we go with thumb kneading could be given, circular manner and friction massage could be also given surrounding the incision site. Then is to improve the range of motion, always start with passive movement. Mainly the shoulder abduction would be difficult, so we can go with first 30-40 degrees, then we can go with 90 degrees, and then we can progress to 120 degree and 180 degrees, slowly will progress. Then we can start with all the movements of the shoulder, flexion, extension, internal, external rotation, passively. Then you go for active assisted, you can use like one stick could be used for flexion, extension, right, abduction, adduction. Then we can use any other device like shoulder wheel could be used later on. Okay, and then you can progress to active movements. Once patient is able to do without any pain, you can go with active movements. Repetition, you can go for 10 times each, you can go. Then is to improve the strength. So for strength, you can start with isometrics. You can start with isometrics of all the muscles of the shoulder as well as neck and head and neck could be also done. Okay, so you can start with it. You can write like this in an example. For I had written deltoid, so you can write the position. Patient will be sitting 90-degree, elbow will be flexed, and therapist have to instruct the patient to do shoulder abduction, right, to bring the hand towards outer side, and therapist will provide the resistance to it, and they have to oppose the movement. And you have to write repetitions and hold. You have to give for at least 20 to 30 seconds or whatever it is, right? Then to improve the strength, we can use many resistance like dumbbells could be used, TheraVents, TheraTubes could be used, medicine ball, kettlebells could be used, right? Then you can write about grip strengthening, that if the grip muscles are weak, you can go with finger gripper, power grippers, spring could be used, elastic putties, clay putties are there. Then tennis ball squeeze, you go exercise where you can ask the patient to squeeze the tennis ball. Then is to improve chest expansion. We can go with the position you have to write that patient will be sitting. So basically it is like this. Ask the patient to sit, and a hand should be clasped behind the head, and then on inspiration patient have to bend the trunk backward and horizontally abduct the arm, and on expiration patient has to bend forward and elbows will be close to the head. Okay, and you can go for 5 to 6 times, which will help in improving the chest expansion. Same way you can go for modification, and in that you can go for same thing but with shoulder straight, that is 180-degree flexed. Okay, then another goal was to posture correction. So if the patient because of pain has developed slouch posture, you can go for stretching of the tight muscles like pectoralis, so you can go for that. Then you can go for strengthening of the weak muscle like scapular muscles, rhomboids and all. Okay, and other than this, if patient has any forward head, you can go for chin tucks and neck isometrics in all direction. Even patient could be taught self stretching. You can draw few of these stretching techniques, and you can also mention detail about it. You can draw self stretching like of pectoralis, where you can draw that the patient is standing near the corner of the wall with the T and Y shape of hand, and then stretching the pectoralis, right? You can draw. Stretching is also very goodly given in Kirchner, you could refer that. And the very last thing is, and the last one is advice. So in advice you can ask during the initial phase to go for always printed cuffing, so that it will protect the incision. Avoid any lifting or carrying or pushing or pulling any of the heavy objects. Always make sure you be generally physically fit and have a healthy lifestyle and physically active. So yeah, you can encourage patients for being physically active. Physical fitness is important. So yeah, that's it. And you can always increase the content according to the marks it has been asked for and the time you have left to write the answer. And mainly for 5 marker they very well ask lymphedema. Mostly they ask lymphedema treatment for 5 marker. It is very well given in the Kirchner. You can refer to that book, and it has also been given nicely in Sullivan, so you can refer both of this book for the same. I hope you like this video and hope it is somewhere helpful to you, somewhere guiding you. And yes, that is what my purpose is all about. So thank you so much for watching this.